Welcome from the Harvard Global Equity Initiative and our colleagues at the Harvard School of Public Health and the Harvard Medical School to this incredible fourth meeting that Dr. Rola Shaheen, my dear colleague and one of the world's leaders in breast cancer identification and in devising innovative ways to be able to undertake early detection. I am so pleased to be able to call her my friend and to be able to work with her through our work on breast cancer globally, and particularly as part of the Global Task Force on Expanded Access to Cancer Care and Control. I know that this year the focus is on young and high-risk women, and I think this is incredibly appropriate and necessary given what the evidence is telling us. Our most recent studies from Latin America, undertaken by myself and Dr. Elizabeth Lopez from the National Institute of Public Health of Mexico, show that, for example, in Latin America, and the evidence suggests the same would be true throughout the developing world, throughout the world, we are seeing younger and younger women appearing with breast cancer. Certainly, a proportion of this is due to the fact that our populations are younger. The populations of developing countries tend to be made up more of younger women than of older women compared to higher income countries like Canada or the United States. Still, what research is showing that about 70% of the earlier age, a detection of breast cancer can be explained by these demographic differences, and so will change in the next 50, 60, or 70 years as our population age. There's another 30% that remains unexplained. We do not know for 30% of the difference what is the cause, why are we seeing much younger women diagnosed with breast cancer in developing regions throughout the world. And when I say younger, we're seeing a difference of approximately 10 years, approximately 1 decade in age of detection. And that means that we're seeing much younger women, so premenopausal, women who are at high risk for particularly aggressive breast cancers being diagnosed in developing countries. Furthermore, we know that the vast majority, about 70%, are detected in late stages. This means that the age of diagnosis, if we were to compare it to a country like Canada or the United States or Europe, would in fact show an even larger difference because the probability of late detection is actually much lower, as we know, in these higher income countries to the north. There, it's only about 10% that are detected in such late stages. So given that we're seeing such late detection, yet earlier onset, younger women, particularly aggressive, we have to develop new and different policies and new and different ways of reaching out to those who are at greatest need and greatest risks in countries like Latin America, where I do most of work, like Mexico, where I do most of my work, but also in the Arab world, in Abu Dhabi, where I know you're sitting today to work at this disease. We have to underline an issue that Rola, thank goodness, has decided to take on as a cause. And I know that several of the people that will be speaking this evening with you are going to be discussing this issue. Younger women also mean a younger age in terms of their reproductive life. It means that there are all sorts of different challenges that we face and that they face. And I say we because I myself was diagnosed in Mexico in a small clinic at age 41 with invasive breast cancer. Mastectomized, left side mastectomized, and after a year's worth of chemotherapy and Herceptin and 5 years of hormonal treatment for the standard triple positive breast cancer, which is so common among younger women. Triple positive, hormone sensitive cancers like that I had, like so many young women have in the countries in which we live. Those of us who face this at a young age and these kind of cancers face these new sorts of challenges. These kinds of challenges that are associated with early induced menopause, that are associated with a series of battles that we face in terms of our own sexual health, in terms of our mental health, and in terms of our relationship both to our families, to our husbands and partners, and in fact also to our children. The fact that in this seminar and the work you're doing, you're going to be taking this head on and discussing it, I think is a huge move forward, both for all of what we do for breast cancer throughout the world, but also, and in particular, for women's health. Women's health is a global issue, and particularly the health of our younger women. So I thank you. I thank you as one who lives with this disease. I thank you for all your work with Rola, for your work with my friend, with Dr. Shaheen, And I thank you for all that you'll do that will help us to understand so much about breast cancer in your region that we can then apply in other regions throughout the world. So thank you on behalf of the Harvard Global Equity Initiative and our Global Task Force on Cancer Care and Control in Developing Countries.